Everything about hypertension. What is high blood pressure? Hypertension means high levels of pressure caused by blood hitting the artery wall. Arteries are vessels that deliver blood from the heart to all organs. Blood pressure is determined by two numbers. Systolic blood pressure, upper number, indicates the pressure inserted into the artery wall during heart contraction, and diastolic blood pressure, lower number, indicates the pressure inserted into the artery wall when the heart muscles are released between each heartbeat. Blood pressure is one of the main signs of life. When large arteries lose their natural elasticity and strength and small vessels become narrower, blood pressure rises. High blood pressure is sometimes called deadly quietly, because until the end stages it often has no symptoms. Blood pressure naturally rises due to stress and physical activity, but a person with hypertension also has higher blood pressure than normal during rest. Normally, blood pressure should be less than 120/80ths. If the blood pressure is between 120/80ths and 139/899ths, the person is at risk of hypertension, and blood pressure 140/90ths and above indicates hypertension. During pregnancy blood pressure, naturally, should be less than 120,800. High blood pressure causes complications such as heart disease, renal failure, atherosclerosis, eye injuries and stroke and damage to the brain. Also, about 60% of diabetics have experienced hypertension. Statistics show that 1 out of 5 hypertension patients are not aware of the disease. This is one of the most important risk factors for heart attack and stroke. Lack of proper treatment for high blood pressure can lead to heart, brain, kidney, pulmonary and circulatory impairment without any specific symptoms. Some people may experience the following symptoms as blood pressure rises sharply: severe headaches, dizziness, shortness of breath, blurred vision, feeling a pulse in the head or neck, nausea, fatigue, pain in the chest, blood in the urine. The blood pressure measurement unit is millimeters (mHg), as mercury is used in the first accurate barometers and is now used as a standard unit for measuring pressure in medicine. If you have blood pressure above 180.120 mmHg and symptoms such as chest pain, shortness of breath, pain in the back and between the scapulas, numbness or weakness, visual impairment or difficulty speaking, we should not wait for the pressure to come down and we should contact the emergency room immediately. As a general guide, normal blood pressure between 90.60 and less than 120.80 millimeters of mercury is considered. Pressure of 140.90 millimeters of mercury or higher, high blood pressure, and pressure less than 90.60 millimeters of mercury are considered low blood pressure. Emergency conditions in high blood pressure. If your systolic pressure exceeds 180 or your diastolic pressure exceeds 120, you are at risk of a hypertension crisis. Critical blood pressure can lead to stroke, heart attack or kidney damage. We advise you to take a few minutes off and re-measure your blood pressure. If there is still a lot, call the emergency room. Symptoms including severe headache, anxiety and nasal bleeding can be seen at the risk range pressure. You may feel shortness of breath or be unconscious. What factors affect blood pressure? Blood pressure changes throughout the day under the influence of a variety of factors, including body posture, brain activity, digestive activity, muscle activity, nerve stimulation, painful stimulation, full bladder, environmental factors such as air temperature and noise, smoking, alcohol, tea, coffee and medicine. Complications of hypertension: heart attack and stroke, heart failure, metabolic syndromes, learning and memory problems, thick, narrow or tearing of the eye vessels, kidney problems. Treatment and prevention: quit smoking, exercising at least 3 days a week, no alcohol consumption, weight loss, low salt and low fat foods, reduce the consumption of caffeine-containing foods, less consumption of red meat, reduce stress and nervousness, Adequate rest during the day. Reduce the use of contraceptives and antidepressants. High water consumption. Deep breathing. Reducing sugar and confectionery consumption. Periodic measurement of blood pressure. Consumption of fruits and vegetables. Pause a little in the morning when you wake up before getting out of bed. What's good for lowering blood pressure? Cinnamon, saffron, grapefruit, apple, asparagus, okra, almond, garlic, celery, dark chocolate, tomato, onion, carrot, raisin, mushroom, potato, pumpkin, spinach. How is high blood pressure diagnosed? Blood pressure. Blood pressure is measured several times under standard conditions. Chest echo may show signs of heart failure and enlarged heart. Electrocardiology. It may indicate the magnitude of the left ventricle or local anemia, ischemia. Blood tests. Urea and electrolytes to check kidney function as well as lipids and blood sugar. Urine test. To find kidney disease. Observing items before accurate blood pressure measurements. Don't smoke an hour before measuring. Don't exercise. Don't drink caffeinated drinks. Sit in a chair for 5 to 10 minutes before measuring daft and don't talk. Let the doctor know the medicine we're eating. Put our hands on the surface of the heart and not dangling. What are the reasons for hypertension? Passing cigarettes. Overweight and obesity. Lack of physical activity. High salt intake and sodium sensitivity. Alcohol consumption. Stress. Aging. Genetic factors. Disorders adrenal gland and thyroid. Sleep disorders. Chronic kidney disease. Vitamin D deficiency. What people are most prone to hypertension? Hypertension is common among people over 45 years of old. Meanwhile, the share of men is higher than that of women. These statistics are photographed in people over the age of 65 in a way that women are more affected by hypertension. Having a family history is one of the risk factors for hypertension. Race is also effective in increasing the risk of the disease. Genetic reasons for high blood pressure. In many families, high blood pressure is an inherited disease. The results of many studies have shown the effect of some genes and genetic mutations on hypertension. Of course, cases of hypertension due to genetic factors account for only 2 to 3% of all cases. Disrupting the balance of water and salt in the body. Normally, the kidneys are responsible for balancing the body's water and salt, and they do so by preserving sodium and water and excreting potassium. If this kidney function is impaired, the volume of blood in the body increases, which increases blood pressure. Renin system problems, angiotensin, aldosterone. Renin-angiotensin-aldosterone system in the body is responsible for the production of angiotensin and aldosterone hormones. The hormone angiotensin causes narrowing of the body's vessels, which causes high blood pressure in the body. Aldosterone hormone affects kidney function in water and salt retention. Increased aldosterone hormone in the body affects the function of the kidneys and increases blood volume and consequently increases blood pressure. Sympathetic nervous system function. The function of the sympathetic system of the body has an important effect on regulating blood pressure in the body. The system affects heart rate rhythm, respiratory rhythm and blood pressure. Researchers are investigating how sympathetic system imbalances affect hypertension. Function and structure of the body's vessels. Changes in the function and structure of small or large vessels of the body can cause hypertension. The hormone angiotensin and the immune system can cause stenosis and shrinkage of the body's vessels, which affects blood pressure levels. Other diseases. Other causes of hypertension include diseases such as chronic renal failure, sleep apneic interruption, thyroid disorders and some tumors. Low blood pressure and its symptoms. Sometimes you experience hypotension due to prolonged standing or lack of food or dehydration. Symptoms of low blood pressure occur as dizziness, lightheadedness, blurred vision, increased heart rate, nausea, and general weakness. In such cases, the best thing to do is to drink plenty of water and lie down. You can pour and consume very little salt in the water. Golden tips. Aging does not necessarily mean hypertension, and the effects of aging on hypertension are very low. High blood pressure can often be prevented or controlled by healthy nutrition, maintaining proper weight, exercising regularly, abstaining from drinking alcohol, and not smoking.